Welcome to our training on the Mental Status Examination, or MSE. This crucial tool helps us understand a patient's mental state. Think of the MSE as a way to objectively describe what you observe about a patient's mental functioning. This information, combined with their history, helps us make accurate diagnoses. It also guides us in developing effective treatment plans. The MSE differs from a patient's history. A patient's history is what happened in the past. The MSE is about what is happening right now. It captures the patient's mental state at this very moment. Imagine taking a photograph. The MSE provides a snapshot of the patient's mental state. In this section, we'll focus on the appearance aspect of the MSE. Observing a patient's appearance can offer valuable insights. Each piece of information, no matter how small, contributes to the bigger picture. We start by observing the patient's overall appearance. Do they appear their stated age, or do they look older or younger? Next, we consider their build and body type. Is the patient thin, frail, obese, or muscular? These observations can provide clues about their physical health. Next, we focus on the patient's clothing and grooming. These aspects can reveal a lot about their self-care, social awareness, and even their thought processes. Start by observing their clothing. Is it appropriate for the weather and the social context? Is it clean and well maintained? Or is it dirty, disheveled, or mismatched? Grooming is another important factor. Observe the patient's hair, nails, and teeth. Are they clean and well groomed? Or are they unkempt and neglected? Poor hygiene can be a sign of depression, psychosis, or dementia. In this section, we'll delve into the patient's attitude towards the examiner. This aspect of the MSE is crucial, as it directly impacts the quality of information we can gather.
Think of it like this. Entering a room where the atmosphere is tense immediately changes how you interact.
Similarly, a patient's demeanor during the MSE significantly influences the dynamic between the examiner and the patient. We use specific terms to describe a patient's attitude towards the examiner.
Is the patient cooperative and friendly, or are they hostile, guarded, or suspicious?
For instance, a patient who is overly familiar or seductive might be exhibiting signs of mania. The level of rapport we establish with the patient is paramount. A strong rapport can encourage the patient to feel more comfortable and open up. This, in turn, leads to a more accurate and informative MSE.
Consider a patient who is initially resistant to the examination. They might be reluctant to answer questions or make eye contact. Our approach should be patient and non-judgmental.
Let's turn our attention to speech characteristics. This aspect of the MSE focuses on how patients express themselves verbally. Their speech patterns can reveal a great deal about their thought processes, emotional state, and overall mental organization.
Think of it like listening to music. The rhythm, tempo, and volume all contribute to the overall feel and message of the song.
First, we consider the rate of speech. How fast or slow is the patient speaking? The melody of words, quality, and tone. Now let's focus on the quality of speech. This refers to the clarity, fluency, and content of the patient's speech. Is their speech clear and easy to understand? Or is it slurred, mumbled, or incoherent?
We might describe their speech as pressured, monotonous, whispered, or shouting, depending on the specific characteristics we observe.
Conversely, someone experiencing mania might speak in a loud, rapid, and highly animated manner. Observing the silent language of the body. Moving on from speech, we'll now explore behavior and psychomotor activity. Even when words are unspoken, the body speaks volumes.
A patient's movements, gestures, and overall demeanor provide crucial information about their mental state. Think of it like watching a dance. Every movement, every pause, every gesture contributes to the story being told.
During the MSE, we pay close attention to a patient's psychomotor activity. Are they restless and fidgety, constantly shifting in their seat, or are they slow and lethargic, their movements labored and minimal? Agitation and retardation, extremes on a spectrum. Two key terms we use to describe psychomotor activity are agitation and retardation.
Agitation refers to excessive motor activity and inner restlessness. Imagine a patient pacing, unable to sit still. This can be a sign of anxiety or mania.
On the other end is psychomotor retardation. This refers to a slowing down of activity. Decoding mood. The emotional background. Now let's delve into mood and affect, two essential components of the MSE that provide a window into a patient's emotional landscape. Think of mood as the emotional backdrop of a person's experience. It's the persistent emotion, that colors their perception of themselves and the world around them. Assessing mood involves understanding its various dimensions. The face is a mirror. Understanding affect. Affect refers to the outward expression of emotions. It's the immediate, observable manifestation of feelings. Think of it as the reflection of their inner emotional world. We use specific terms to describe a patient's affect. These terms help capture the nuances of their emotional expression. Is their affect blunted or flat, lacking usual emotional range? Or is it labial, with rapid shifts in emotional expression? When senses deceive. Understanding perceptual disturbances. Now let's explore the fascinating and sometimes unsettling realm of perception. Perception, in the context of the MSE, refers to how a patient experiences the world through their senses. It's about how they see, hear, smell, taste, and feel the world around them. When our senses function typically, we take this seamless integration of sensory information for granted. However, certain mental health conditions can disrupt this delicate balance, leading to perceptual disturbances. These disturbances can range from mild distortions of reality to profound hallucinations that feel as real as any other experience. Beyond the five senses, delusions and other perceptual shifts. Hallucinations involve experiencing things that aren't there, while illusions are misinterpretations of real sensory stimuli. A patient might mistake a coat rack for a person or interpret rustling leaves as whispering. These misinterpretations blur the line between what is real and what is not. Another crucial aspect is the presence of delusions. The threads of thought. Assessing thought process. Shifting our focus from the sensory world, we now enter the realm of thought. In the MSE, we examine both the thought process and thought content to gain a comprehensive understanding of a patient's cognitive and mental state. Think of thought process as the way in which thoughts flow and connect. When assessing thought process, we pay close attention to the organization, coherence, and logical flow of ideas. Behind the curtain, unveiling thought content. While thought process focuses on the how of thinking, thought content delves into the what, the actual thoughts, beliefs, and preoccupations that occupy a patient's mind. Think of it as peering behind the curtain of consciousness to glimpse the inner workings of their mental world. Assessing thought content requires sensitivity, respect, and a non-judgmental approach. We begin by exploring the patient's current concerns and preoccupations. Now, we'll shift our attention to cognition, a crucial aspect of the MSE that assesses a patient's mental processes involved in thinking, knowing, remembering, and understanding. These cognitive abilities are fundamental to our daily functioning. Imagine our minds as a complex orchestra with different instruments responsible for various cognitive functions. The MSE's cognitive assessment is akin to listening carefully to each instrument, checking for any signs of discord or weakness. We evaluate key cognitive domains like orientation, memory, attention, language, and executive function. Beyond memory, assessing executive function. Attention and concentration are crucial cognitive functions. Attention is focusing on a task. Concentration is maintaining that focus. Distractibility and impaired concentration can indicate ADHD, anxiety, or mood disorders. We assess these by asking patients to count backward or recite the alphabet backward. Mirrors of self-awareness, assessing insight. In this section, we'll explore insight and judgment, two intertwined aspects of the MSE that provide a glimpse into a patient's self-awareness and decision-making abilities. Imagine insight as a mirror reflecting a person's understanding of their own mental health. It's the degree to which they recognize that they are experiencing symptoms of a mental illness and can acknowledge the impact of these symptoms on their thoughts, feelings, and behaviors. Assessing insight is not about labeling patients as insightful or lacking insight. Instead, it's about understanding their level of awareness along a spectrum. Navigating life's crossroads, evaluating judgment. While insight reflects a patient's understanding of their illness, judgment refers to their capacity to make sound, reasoned decisions, particularly in challenging or ambiguous situations. Think of judgment as a compass guiding a person's choices and actions. When functioning well, it helps us navigate life's complexities, weigh potential consequences, and make choices aligned with our values and goals. Assessing judgment during the MSE involves understanding how a patient approaches decision-making, considers potential outcomes, and learns from past experiences. Section 1. The enduring value of the MSE. The mental status examination is crucial in clinical practice. It's a dynamic tool providing insight into a patient's subjective experience. By observing appearance, behavior, speech, mood, and cognition, we gather invaluable information. The MSE evolves with each patient encounter. Repeating the MSE tracks changes and monitors treatment response. It's about understanding the person behind the symptoms, listening with empathy and observing with sensitivity. Integrating observation with assessment provides compassionate care. The MSE remains an enduring pillar in mental health care, ensuring every patient receives the attention they deserve.